You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mother of four, and a teratogen information specialist. So what I do is I give people information about exposures during pregnancy, breastfeeding, also before pregnancy, and in cases of adoption. And an exposure can be anything. So it could be a medication, it could be hair dye, or it could be household cleaning products. And that's what we're going to talk about today. So not only has spring already sprung, and lots of people are thinking about spring cleaning, but there's other things going around, things like the flu, obviously COVID. And so people ask us quite a bit about different disinfectants during pregnancy and breastfeeding. And I am very excited to have our guest with us today, back with us today, I should say, Al Romeo from MotherToBaby Utah, who is a registered nurse with a doctorate in health education. He works as a teratogen counselor for the MotherToBaby program. He works to prevent birth defects and developmental delays, and also to help parents and providers recognize those developmental delays early so people can get the care that they need. Al, thank you so much for being back with us.
Yes, thank you for having me back today.
This is one that I get questions about all the time, of course, because it's so common. Things like household cleaning products. And my guess is that you get a lot of those questions too.
Absolutely. This is something that we all have in our houses. We've got kids, we've got to do the cleaning. So it's something that we're exposed to all the time. So we'll talk about some of those different cleaning chemicals.
Yes, that's what I keep telling myself. You have to do the cleaning. You have to do the cleaning. Not my favorite thing, I must say. So what types of cleaners are we talking about?
So we'll talk about some of those different, like the bathroom cleaners. You may have bleach and ammonia and those types of things. But we'll start off with hand sanitizers because, yes, during COVID, during the flu season and cold season, we're using a lot of that hand sanitizer. Now, this is one of those that you're going to get on your hands. Most of those other ones, we'll talk about not getting them on your hands and your skin. But this one, those hand sanitizers, the whole purpose of that is to get it on your hands to clean those germs off of your hands, just kind of daily use. Now, this doesn't substitute for hand washing, but in some of those situations where we don't have access to water, we may be out at the grocery store with the kids and, get some hand sanitizer as you go in and you're touching those different things. That hand sanitizer usually contains alcohol. Mm-hmm. And you've probably heard to avoid drinking alcohol during pregnancy, but the amount that you're going to get in through the skin by putting that hand sanitizer on the skin is not going to be a problem for the pregnancy. So go ahead and use that hand sanitizer as needed, because those diseases are usually worse for the pregnancy, like COVID-19, than the hand sanitizer.
So you mentioned ammonia and bleach, which hopefully everyone knows, but we're happy to remind people those are a no-no to mix together.
Absolutely. Mixing the ammonia and the bleach together creates a toxic gas, and it can be very harmful for everyone. So yes, don't mix those different cleaning chemicals together. If you need to use different cleaning chemicals, use them in different places. Sometimes if you're in the bathroom and you use bleach here and you use ammonia there, if there's some areas where you may use both of those, you can rinse in between and get rid of those. But yes, don't mix those chemicals together.
Okay. And so aside from the mixing, which you don't do, we are still at some level breathing in chemicals. Is that right?
Yes, you will smell those different chemicals, but try not to get a dose of those into your system. Of course, make sure that you're washing hands after using those. Some of those are a little bit more hard on the skin. So, you can use gloves to reduce how much of the bleach gets on your skin. But either way, when you're using those different chemicals, wash hands afterwards. Even your hand sanitizer. Once you come home from the grocery store and you've used the hand sanitizer there, wash your hands before eating or feeding the kids or those different types of things. So get those chemicals off of your skin. But for breathing the chemicals, as long as mom isn't getting sick from those different fumes from the chemicals, like I said, she's going to smell them, but as long as she's not having nausea, vomiting, dizziness, headaches, those different types of things, then she's not really going to get a dose of those chemicals into the system. If those fumes start to overwhelm her, like bleach, bleach can be very caustic, and it can, be very difficult to breathe in an area with bleach. Take a break, get some fresh air. If you're in the bathroom, turn on the bathroom fan so that you're not getting too much of that into your system from breathing from it, because it's not good for your system. The bleach, if there's too much in the air, can harm the cells in the nose and those different types of things. So make sure you have plenty of fresh air when you're using these different cleaning chemicals.
Yeah, it would always be a good idea when you can to pop open a window just to get some of that air moving out. And, if you absolutely need to, step outside, go out and get as much of that fresh air as you can, which hopefully is a little bit easier now as the temperatures start to warm up across the country.
Absolutely. Yeah. Make sure that you're getting, yes, plenty of that fresh air. Springtime cleaning, yes, open up some of those windows and let that fresh air in.
What are some other tips about handling or using household chemicals?
So one of the things to remember about some of those different chemicals is there's a difference between cleaning and disinfecting. So in areas where things may be dirty, first you want to clean them, and that's where your bleach and ammonia and those different types of cleaning products come into use. For after those different things are cleaned, and in between the different cleanings, we want to do some disinfecting. For example, when we have a cold or flu, those germs are in the air. We get them on our hands. We cough, we sneeze, those types of things, and we touch different things in the house. So that's where the disinfecting is important between cleanings. So disinfect the doorknobs or keyboards or those different types of things that you're touching or other people may be touching. And those different disinfectants may have alcohol in them and other different products for that disinfecting process. So remember, there's the difference between cleaning and disinfecting. There's different times to use those.
And what about different surfaces?
So yeah, there are different surfaces in our household, and we need to look at the recommendations for how to either clean or disinfect them. For example, in the kitchen, there are different surfaces that we want to use different products for. Some of them you don't want to use bleach on. Some of them you don't want to use vinegar on. It may damage them. So look at whatever products that you have and follow those instructions. For some of the things like our electronics, we're working remotely from home, or the kids may be having classes at home. So those electronic products, generally, those are cleaned with alcohol. And what you do, of course, is make sure that those different electronics are turned off first, and then clean them with alcohol, following those directions. Usually you use a wipe with alcohol. You're not trying to soak it. You're not trying to get too much in it. You're just wiping the surfaces where you have touched. And once those different electronics have completely dried, the alcohol dries pretty fast. Once they're dried, you can turn them on and use them again. But the key point to remember is that different things have different ways to clean them and different chemicals to use to clean them, and follow those directions.
Got that. I think I remember reading a while ago that, your phone and your keyboard, whether it's, your home laptop or your work laptop, are some of the dirtier surfaces that we come in contact with. And of course, at least I'm in contact with my phone pretty regularly. So it makes sense when you think about it. And it also is a good idea to remember that, different surfaces require different chemicals.
Yes, and yeah, we're touching that phone all of the time. We're touching that keyboard all of the time. And it may be painful to turn it off for a few minutes, but yeah, go ahead and power those down and go ahead and clean them up every once in a while. And they'll be dry pretty quickly, and then you can turn it back on and use it again.
Yeah, it is a good idea, especially, in this new age, if you will, with COVID and everything, but still flu and colds and those things are still around too, sneaking up on us, whether we like it or not. So it is a good idea to keep those surfaces clean.
Yes, absolutely. Those things are still going around, and this is just part of the precautions for the COVID and flu and colds and all of those different diseases that are going around, RSV. So the cleaning and disinfecting is only part of that. Of course, if you have those different diseases, you want to stay away from other people. You can wear a mask when you're going out into public to prevent getting those respiratory diseases that we've talked about. So there's other strategies that go into the process, but cleaning is just one of those things to do to help protect the family from those different respiratory or other viruses.
Absolutely. And my toddler's current favorite and least favorite activity is washing hands. So just a reminder to, wash your hands well and often, make sure you dry them well. She likes to take turns either playing in the water or actively running away from me as I try to wash her hands.
Yes, it's always fun with kids and hand washing. Of course, the length of time makes a difference there. So, put on the soap and lather up and sing your ABCs so that they get a nice, good washing there before.
That's awesome. And Al, anything that you'd like to leave the listeners with as we wrap this up?
Absolutely. So if you have questions about these different chemicals, if you use some of these chemicals in an occupational setting, maybe you're a nurse and you use these chemicals to clean hospital rooms, or you work to do cleaning in industrial settings, we can answer those questions about those different chemicals also. But you feel free to give us a call, visit us at MotherToBaby.org, and we're happy to answer your questions.
Great. Al, thank you so much for being back. I know we'll have you again in the future, but for now, we really appreciate you being here.
And thanks for having me out today.
Our pleasure. And thank you to everyone for listening to this episode. And here we are all done. So make sure you subscribe to the Mother to Baby podcast. That way you never miss a new episode. And you can also go back and listen to some of the older episodes as well. You can find us on iTunes, Spotify, or however you listen to podcasts. And if you want to be on the show, we would love to hear from you. So feel free to email us at contactus@mothertobaby.org. Also, if you don't want to be on the show, but you have an idea, we would love to hear from you. So definitely email us. If you want to speak to a mother to baby counselor or get some teratogen information, you can call us. So we have our toll-free number at 866-626-6847. You can text us at 855-999-3525. You can visit our website, MotherToBaby.org, where you can live chat with a teratogen information specialist. You can also find our fact sheets, which are completely free. And we have over 250 different fact sheets, and we have them in English and in Spanish, completely free to you. And we also have our baby blogs, and we have our podcast too. So feel free to come and find us at MotherToBaby.org. And as always, please remember that Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.